No.
Are you feeling lost of energy all the time?
Yes, as I told you, I feel tired all over the day.
Right. Any sweating?
No.
No, right. Okay. Thank you. So are you suffering from any medical problem?
No. Have no any medical problem.
Have you had a surgery in the past?
No.
Are you taking any regular medication?
No.
Any herbal medication or over-the-counter medication by any chance?
No.
No, right. Okay. And so is there any family history of any medical problem?
No, I have no any family history of similar of any medical problem.
Right. Okay. And who is at home with you?
Yes, I live with my wife.
With your wife, right. And are
Yeah,
you
yeah.
normally independent in activities of your daily life?
Yes, I'm dependent. Yes, I'm totally dependent on myself.
Right. Do you smoke?
Yes, doctor, I stopped smoking
How long did you smoke?
recently.
How long did you smoke?
Yes, doctor, I smoke 14 years.
14 years. And how many cigarettes per day?
I used to smoke 20 cigarettes per day.
Right. Okay. Do you drink alcohol?
No.
Right. Okay. Have you lost any weight?
Yes, doctor, I have loss of my weight. I noticed that I became more thinner.
Right. How much weight have you lost?
I think I lost about 4 kilos during this period. 4 kilos.
How is your appetite?
I have 2 minutes, doctor, remaining to complete the history. And my appetite, I think it is not good.
I think I will take 2 more because there was some disruption in the history. So
Okay.
if you will give,
I think you can. Yeah. We'll give you 2 minutes. 2
right.
minutes.
And your appetite
After
is good,
that,
right?
okay?
Have you observed any lumps and bumps in your body?
No.
No, right. Okay, thank you. I will ask you a few private questions if that's okay with you. Are you in a stable relationship?
Yes, I have a stable relationship.
By any chance, any other partner beside your wife?
No.
No, right. Okay, thank you. Have you traveled recently somewhere?
No, I have no traveling history.
Right. And how is your mood, sir?
Yeah, doctor. Now I'm totally occupied by this. What is happening to me? Really, I feel that I have some nasty problem.
Right. Okay. Let me summarize what you have told me, and then I will come to your concerns. Right. So you told me from
Okay,
last 3
doctor.
weeks you are having this. You are having this fever, fatigue, and you are coughing up blood as well, on and off. And so you have observed some red color staining of your urine as well, and you have got joint pains all over the body with some stiffness with that. And you was you have been smoking, but you stopped smoking. And can I ask you what's your job?
Yes, I'm a taxi driver.
Taxi driver, right?
Now,
And
now you
right.
have 2 minutes, doctor, to complete your history. Okay?
Okay. So what's your concerns?
As I told you, doctor, what is going on? What is my problem? What is the cause of my problem?
Right. Okay. So from the
Why
history
I'm
you
not
have told
responding, and why I'm not responding to antibiotics that given to me?
Right. Okay. So, yeah, your concerns are quite valid. But let me tell you,
Thank
the
you.
history from the history you have told me, we need to do investigations and do your examination to come to know exactly what's going on. But history is suggestive of a medical problem we call vasculitis. Have you heard about that?
No, doctor. What is vasculitis?
So, yeah, it's a inflammation of the blood channels in the body, in which the defense mechanism of the body attacks its own body tissue and the blood channels. And because of this, you are having these symptoms like you are having fever and you are coughing up blood and you are passing blood in the urine as well, and these joint pain and stiffness. So what we need to do is we need to give you some medicine.
Yeah.
Sorry?
Yeah. What?
Yeah, so you are not responding to antibiotics because my colleague thought that is an infection, but I think you need some medication to suppress the defense mechanism of the body, and these medication will help with your symptoms.
Okay. 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 Nice. Nice. Very
Do you
good.
understand what I mean?
Yes. Is it treatable?
Yeah, if we will give you the medication and if you will be continued on these medication,
Now I
then
think
your
your
symptoms will
time.
be well controlled.
Your time. Need to connect.
Yeah, thank you.
Thank you. Okay, doctor. Could you give us a summary of about this case?
Yeah, this 35 years old young gentleman is coming in with his 3 week history of fever, weight loss, feeling tired, fatigued, and coughing up and hemoptysis from last 3 weeks. He is having generalized joint pains associated with stiffness. So, based on this history, and he's having the symptoms of hematuria from last 3 weeks with cough and shortness of breath. So based on this history, most likely diagnosis for this young gentleman will be vasculitis.
So what is your differential diagnosis?
So differential diagnoses are down on the list will be um, uh, in the differential, the two causes of vasculitis: granulomatosis, polyangiitis, and the differential will be Churg-Strauss, bronchiectasis, and lung abscess.
Okay. What else?
I can't think of any other reasonable diagnosis.
Okay. So you are. So what is your plan of management?
So the plan of the management will be we need to do full examination of this gentleman and do the
Including.
investigation. Uh,
Okay.
investigation.
What are the investigation you would like to do?
So we'd like to do some blood tests like full blood count to look for anemia or high white cell count or low white cell count, and we would like to check ESR and CRP, and we will check the clotting screen of this patient with hemoptysis, and we will check serum ANA and ANCA levels as well, and after that we do chest x-ray in this gentleman to find out any infected cause for this hemoptysis or any
ultrasound.
vascular lesion,
يا حبيبي
and
تعال خد
we need to do ECG in this gentleman, and we need to
ECG.
send the urine for complete analysis to the lab.
مش ECG.
يلا مين حضري يا حبيبي
Okay.
hello
Hello. Okay. 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 Doctor. Okay. So okay. Continue.
Yeah. So these are the investigation, and after that, this gentleman, after the confirmation of the
Okay.
diagnosis,
So do you want to add anything?
in the these are the investigation, but after that we need to start, after the confirmation of diagnosis, we would like to start this patient on in the acute phase on steroids, and after that on the immunosuppressive agent and steroid sparing agents like azathioprine and the cyclophosphamide.
Okay. What is sort of corticosteroid you will start in this gentleman? What is the name of steroid?
So
I mean,
we can in the acute phase we can start on methylprednisolone IV in this gentleman.
Prednisolone. Did you hear about
Yeah.
methylprednisolone?
In the acute phase, yeah.
Yeah, very good. Okay. So how would you follow this gentleman?
So the follow-up for this gentleman will be in the acute phase after the steroids. We need to start this patient on immunosuppressive agents like azathioprine, cyclophosphamide, and it will be the follow-up for those medication to check his blood count regularly and liver function test as well. And
Nice, very
we
good.
need to give him,
What are
and we need to give him
precaution? What are the precaution?
Yeah, we need to give him family as well. Like if he want to have another children and he's on these medication, he need to take advice from his doctor. Okay. And if he get any kind of infection in the future,
thank you. I fear your time is finished up now, and okay, we need to discuss about this case. Okay, actually this is I tried as much as possible to give you the scenario and give you the same question that I have been asked with the examiner. Yes, this is the scenario of this 5 years old, complained of fever and hemoptysis, and he had also fatigability with joint pain, generalized joint pain that increased with accompanied by stiffness. That indicates this is this sort of joint pain. It is inflammatory. Okay, and obviously the case is due to autoimmune disease, vasculitis. But in history, Dr. Amjad, you have to broad your differential diagnosis, to broad your mind. In history, you have 5 minutes, and I told you this is 5 minutes. It is really 4 minutes because 1 minute will be lost since you transmit it from station 4 to station 1 to station 5 to station 1. This is or station 2. Station 1 to station 2. You have this 1 minute will be lost in nothing. Okay, you have 4 minutes. try to use this 4 minutes as much as possible. You have to put I think that from our side, I know this from our side, this is vasculitis. Most likely diagnosis is vasculitis. Okay? But you have to broad your differential diagnosis. So if I asked you, you have, forget MRCP. Forget MRCP. Fatigability and joint pain and fever. What is your differential diagnosis besides vasculitis? The most common.
So then it will be bronchiectasis or lung abscess.
So what are the causes of what are the most common causes of bronchiectasis?
Common causes of bronchiectasis will be malignancy.
No.
Obstruction.
No. Okay. What are the infection? What is the most common infection? Yeah. What is the most common infectious agent that's causing respiratory illnesses?
It will be strep pneumonia.
Okay, good. But tuberculosis, I think, is the most common causes that's causing a lot different presentation like that. Yani, if you look, this gentleman have history of 3 weeks, just history of 3 weeks of this complaint. Usually doesn't going on with bronchiectasis, although bronchiectasis need long time. Okay, so I think tuberculosis is one of the other possibilities. So in the history, once you put differential diagnosis of tuberculosis, you have to ask question about contact. You have to ask about contact with any chest patient, any cough patient. What about his traveling, as you explained, as you ask about travel. This is good point. You ask about constitution and symptoms such as weight loss, such as fatigability, such as loss of appetite, loss of weight, sweating, night sweating. This is the question that should be asked regarding tuberculosis. Okay? You have to satisfy this point to rule out tuberculosis out. Okay? Okay? You have to tell the examiner, now I'm ruling out tuberculosis by asking this question. Do you have any history of, do you have any contact with any chest patient? Do you previously diagnosed by tuberculosis? Okay? Do you have any fatigability, sweating, and this question that we asked? Okay, we have to rule out this possibility because it is the most common. What other possibility we have in our differential diagnosis? We have to put in our mind, and you ask us the question related to it, and he gives you a hint about that. You mentioned to me malignancy.
Yeah.
Hello. What is the malignancy? Which malignancy? Which malignancy? Could you repeat it, please? Because the voice is echoing. There is echo.
Lung malignancy. Bronchogenic
yeah. What are the risk factors you face? You what are the risk factors he have?
So he had a 14 years history of smoking, and and he has lost some weight, and he is feeling tired.
This is the point. So it is very important to put a malignancy at the bottom of the list. Okay, because this is a possibility. He is a massively smoker for long period, and so the bronchial carcinoma or lung cancer is a possibility. We have to put in our differential, although it is not common, although it is not most likely causing of his problem, but we have to put in our mind and in our differential diagnosis. Okay, you mentioned to me vasculitis. What are the presentations of vasculitis? You mentioned to me Wigner, and you mentioned Goodwasser syndrome. Okay, what are the usual presentation of vasculitis? Which type of vasculitis he have?
So I think he has granulomatosis polyangiitis, also called Wegener granulomatosis.
Okay, so how it present?
So it will present with upper respiratory tract or lower respiratory tract recurrent infection with hemoptysis and with hematuria, and with other symptoms weight loss, loss of appetite, feeling tired and fatigued.
So okay, what else?
So it can present with is it with mononeuritis multiple? I think that's the
Very good.
one. Okay.
Very good. Very good. Very good. Very good. This is very good. You have to ask about the peripheral neuropathy signs. You have to ask about loss of sensation, pain and needle sensation, okay, loss of temperature, يعني loss of painful sensation in your in your bodies, okay, because this is one of the symptoms of vasculitis, okay.
Yeah.
This is the one thing. What other thing?
It can present in the later stage with stroke as well.
Okay, what else besides the stroke? Yes, it can present by stroke. Okay, what else? Does it is it accompanied by pain?
Which pain?
Ears.
Ears pain.
Yeah.
Ears pain. It can cause that.
Yeah. It causing ears pain, causing sometimes difficulty in hearing, deafness, okay?
Yeah.
And it causing sinusitis. And this patient actually have ears pain, have sinusitis, and have joint pain and pin and needle sensation. Right. You have to ask about this question. This is the hidden question that we're not going to give you. You have to ask him. Okay?
Right.
Really, this is once I asked him those questions, he gave me that I have ears pain, I have pain and needle sensation. Okay.
Right.
Okay. What about I saw I noticed that you check about the urine output. You didn't check about history. You asked about the change in urine color. You change and ask. You didn't ask and think about dysuria. You asked about dysuria, but you didn't ask about the urine output. How much he pass? You have to ask. Do you pass? Do you have produce a little water? Do you have or reduce in your water amount? Okay, or urine amount? Okay, because this patient actually have decreased urine output.
Right.
Okay.
Yeah.
In the same time, you have to ask about symptoms of uremia. If you, this patient also he had itching.
Right. Okay.
As a complication. Itching, and he has loss of appetite. Okay, and he has loss of a history of loss of appetite and loss of weight. This could be explained, these symptoms: loss of weight, loss of appetite, and itching, and decreased urine output. That his kidneys is not working well. Okay, and this is the main clinical presentation of vasculitis. Okay.
Yeah.
Okay, this is I think this is the thing that you didn't cover in the history.
Right.
And also you have to ask how. Yes. And in about the plan of money, I would like to ask. I would like to comment about the investigation.
Yeah.
you mentioned to me you want to do CBC, you want to do inflammatory markers. Good, that is good. And chest X-ray.
Yeah.
Chest X-ray. You have to mention that you would like to do high resolution CT.
Yeah.
Okay, high resolution, very important.
Yeah.
Besides that, you didn't mention to me this patient need renal function test.
Yeah.
Very important. Okay.
Yeah. Yeah.
Patient need renal function test. This patient needs sputum for analysis. So right. Okay.
Yeah.
You need a sputum for cultural sensitivity, a sputum for acid for alcohol fast passing life.
Yeah. Yeah.
Another test we need to do respiratory function test. It is logical to do it. Okay.
Yeah.
Another possibility, and it is very important, and I think at least give him hint about renal biopsy. You have to confirm the diagnosis, because you didn't catch from the history, you didn't quote the important point about decrease of his kidney function.
Yeah.
You have to mention that there is we need to do, if we are thinking that your kidney have been involved by this disease that affected different areas in your body. We will need in some stage to do a biopsy from your kidney. We take a snip from your kidney, okay, to confirm our diagnosis.
Yeah.
Yeah. And I think you mentioned to me, Anna, antinuclear antibody. Also, you have to mention to examiner that you would like to look for cytoplasmic antinuclear antibody, ANCA. Okay, C type and B type. Okay, you have to cover. This is all. I think this is the investigation. Okay, hello. Are you hearing?
Yeah.
Yeah. This is the question that. This is investigation. Regarding to plan of management, yes, you did well. But before that, you have to, as you mentioned to me, you have to explain that you need to do full clinical examination and plan of management depend on it. They asked me what type of steroid, which type of steroid you will give for, and how would you protect from the side effect. And they asked me what are the side effects of steroid. You have to ask in gastritis, imperial glucose tolerance test, hypertension. This is the thing that you have to answer. Acute corticosteroid use. Okay, so you have follow up by looking for blood pressure. Follow up by looking for glycemic control of this patient. We need to check his fasting and 2 hour postprandial, and you have to look for hemoglobin 1AC as a baseline before it started. So because this drug might impair his glycemic control. So they want you to answer this question, to answer like this.
Yeah.
At the same time, you have to give a protection in form of gastritis by giving him BBI, and we have to cover him. If an infection, you have to look up for infection. You have to screen up for infection because you will giving him immunosuppression. Okay. He mentioned to you that he had history of repeated infection in his nose. It indicates that he had history of sinusitis. Okay. He might flare up of infection. He might got flare up of infection. So, okay.
Yeah.
Yeah. So this is the point that I asked it. This is my scenario, station 2, and alhamdulillah, I got full mark in this station, and I asked it like this, as I mentioned to you. This is my comment in this.
Good. Thank you very much for.
Thank you. You have any question?
Dr. Muhammad. Dr. Muhammad.
his mark. Do you have? Did you exam for the? Sorry. I would like to ask Dr. Amjad.
Yeah.
Did you exam? Did you got the same stations in?
No, I didn't get.
Yeah. Dr. Hafiz wants me to give you a mark, but I think that okay. Really, I'm not go. I'm not, because I'm not examiner. I don't know, but they are. You have to satisfy the skills, communication skills. Once you are missing some point, they will going to put you at the risk of borderline or unsatisfactory communication skill. Okay, if they have a risk, there is some point in the history. If you don't satisfy the examiner regarding this point, unfortunately, they will going to they minimize you. And some of them, they are generous and they are ignore it. But usually put the bad thing in your mind. Yani if you don't got full mark in C, which is communication, you have you mean that you're missing some point regarding smoking, regarding urine output, itching. That's the point that we discussed. Okay. Also, they want you to regarding a plan of management, which is a skill. I think this is skill. I forget the letter. But plan of management, they have to satisfy it full. You have to be. You have to commit. You have to answer before they asking you. In this point, you give them clearly. I would like to do think this test for this CT high resolution CT scan to exclude any malignancy and to look for any features of tuberculosis. I would like to do urine to looking for sediments, red blood cell count, and I would like to do iron profile, looking for iron profile, and which is indicating that there is vasculitis, complete hemoglobin. Another thing, plan of management have to be clear and organized. Okay, this is my comment.
Right. Thank you.
Really, I think we will got great mark from. You need to practice more. Still you have time, and you did well, wallahi. You did well. You asked most of the question. You answer. You satisfy the concern. This is very important thing. You satisfy it full. You will get full mark in concern. You will get full mark in. You will get full mark in concern. You will get full mark in plan of management, and regarding what communication. But you miss some small tips, just the small questions, and you will, inshallah, you will do it better in the exam. I think for me, you will got full mark.
Inshallah.
Dr. Mohammed, can I ask you some question?
Yeah, you can ask.
Okay. First, congratulations. Second, I want to ask about differential diagnosis. Is it atypical pneumonia and immunoglobulin A and antibody nephritis? Is it part of differential, or it's far from this differential diagnosis?
Yes. Atypical pneumonia and legionella. That is right. One of the differential diagnosis. Yes. Very good one. This is very good combination. But I didn't mention really for examiner. Was what?
Immunoglobulin A, glomerulonephritis.
IgA nephropathy.
Immunoglobulin A deficiency. Yes.
IgA nephropathy. IgA nephropathy usually. Yes, this is vasculitis. It is better to give vasculitis because vasculitis, as you know, there is a small, large vasculitis, medium vasculitis, and a small vasculitis. And vasculitis by itself is divided by ANCA positive and ANCA negative. Okay. One of the anti-cytoplasmic antibody negative. I don't need to explain more about that. There is IgA nephropathy is one of them. Cryoglobulinemia is one of differential diagnosis. But you have to mention vasculitis. This is a broad and cover a lot of differential diagnosis. Yeah.
Okay. Thank you. Great. Thanks.
Thank you.
Please, doctor, Wigner can cause high fever. You said high fever. And can we consider also leukemia with bone marrow suppression?
Yes, this is very important point that you are remind me now. The doctor Amjad should ask about the nature, how much this fever. The fever is not. It is mild to moderate. Okay, if this patient has mild fever, okay, he didn't ask me about this point. Doesn't usually present by high fever.
Okay, because I remember I heard maybe one answer high. It is high, I remember. But if it is high fever, it should be considered leukemia with bone marrow suppression. And also one differential diagnosis is mycoplasma that can cause cold hemoglobin. Called hemolysis. That will also cause the blood will be red because of hemoglobinuria because of hemolysis, and this is more potent than Legionella.
Yeah. Legionella and mycoplasma, differential diagnosis, but the case most likely vasculitis. Hello.
Hello.
Yeah, Dr. Amjad.
Yeah. No, I'm fine. Thank you.
Thank you very much. Thank you. Hoping inshallah we'll get full mark inshallah in the exam. Inshallah.
Sure.
Okay, now we are going to the next station 5. My case.
Yeah.
Okay. Who will do it? Amjad. Now we are asking to see the patient with platelet of 20. Just
20, right.
vital signs are stable.
Right. How old is the patient?
No, you are asked to see a gentleman of 40 years old. Okay, presented with low platelet count.
Right. Okay.
40.